You're sitting in the testing center. You read the question twice. You narrow it down to two answers, and both of them look right. Which one do you pick? That's a priority question. Priority questions trip up even the most prepared nursing students. Not because you don't know the content, but because NCLEX is asking something different than what you think it's asking. And by the end of this video, you know exactly how to think through priority questions every single time. Welcome back to Katie Closet. We're here to help you study smarter. Thank you for visiting my channel. If you're a nursing student that is getting ready for the NCLEX or a new grad who wants to sharpen your critical thinking skills, this video is for you. Today, we're going to break down one of the most tested and most misunderstood question types on the NCLEX, priority questions. We're going to cover the frameworks you need, the traps to avoid, and how to think like the test wants you to think. So let's get right into it. The NCLEX is testing your clinical judgment, your ability to decide what to do first when everything feels urgent. And that's exactly what makes priority questions so difficult. On a regular multiple choice question, there's one right answer and three wrong ones. But on a priority question, you might have two or even three answers that are technically correct. The nurse could do all of those things, but the NCLEX is asking you which one first. Most students tend to get stuck because they choose the answer that feels the most helpful or the most thorough or the most like what a good nurse would eventually do. But eventually is not the same as first. The NCLEX wants you to prioritize, and to do that, you need a system. And that's exactly what we're going to build right now. The first framework every NCLEX student needs to know is the ABCs. Airway, breathing, circulation. I've mentioned this in previous videos, but let's go over it again. Airway comes first because nothing else matters if a patient can't breathe. Breathing comes next because even with an open airway, you need gas exchange. Then circulation. Is the heart moving blood? Is there bleeding? Or is perfusion happening? Safety comes after all of these three. Here's a quick example. Let's say you have 4 patients. One is anxious about surgery tomorrow. One has a blood pressure of 88/50. One is in pain, rated a 6 out of 10. And one is having labored breathing with oxygen saturation dropping to 88%. Who do you see first? If you guess the answer of the patient whose oxygen is dropping to 88%, then you guessed correctly. Their airway and breathing are compromised right now. That is your first priority. You address the ABCs before you get to pain, anxiety, or even low blood pressure. Unless the circulation issue is immediately life-threatening, always run the ABCs first. The second framework is Maslow's hierarchy of needs. You've probably seen this pyramid before. Physiological needs at the bottom, then safety, then love and belonging, then esteem. Self-actualization is at the very top. For the NCLEX, the rule is simple. Physiological needs come first, then safety, then psychosocial needs like emotional support, anxiety, or grief. So if a patient is asking about their discharge instructions, but also has a heart rate of 130 and is diaphoretic, you address the physical problem first. That is the physiological need. The teaching can always wait. So here's where students tend to get confused. When do you use ABCs versus Maslow's? They actually work together. ABCs help you prioritize within physiological needs. Maslow helps you decide when a physiological concern outranks a psychosocial one. If a patient is scared but stable and another patient has a physical need, you go to the physical need first. But here's the exception. If both patients are stable and one has a safety concern, like a confused patient at a risk for a fall, that safety need can move up the list fast. Always ask, is this physical? Is this safety? Or is this emotional? That order tells you where to go. Now, let's talk about one of the most powerful rules in NCLEX priority thinking. When in doubt, address the unstable patient first. What does unstable mean in NCLEX language? It means the patient's condition is actively changing and not in a good direction. Vital signs that are deteriorating, symptoms that are new or getting worse, a situation that could become an emergency if you wait 5 more minutes. Stable means the patient is not at an immediate risk right now. Their condition is being managed. It might not be comfortable, but it is not declining. Here's a scenario. You have 4 patients. Patient 1 had a hip replacement 2 days ago. Pain at a 5 out of 10. Patient 2 is post-op day 1 with the blood pressure dropping from 120 to 90 over the last 2 hours. Patient 3 has a heart failure and is comfortable on their current regimen. And patient 4 is newly admitted with chest pain that started 30 minutes ago. Who do you see first? The correct answer is patient 4 because they have a new onset of chest pain and it is an acute situation, potentially unstable. You don't know what's causing it yet. That is your priority. Patient 2 comes next. A downward trending blood pressure is a sign of instability. You need to investigate that. Patients 1, pain, and patients 3, managed heart failure are both important, but they're stable right now. Stable waits, unstable does not. Here's a little trick that helped me whenever I got stuck between 2 answers and both felt right. First thing, what would a safe, cautious nurse do? The NCLEX is not testing whether you're fast. It's not testing whether you're bold. It is testing whether you are safe. It's written by people who want to know that you will not harm a patient. So whenever you're stuck between 2 answers, ask yourself, what would a cautious, careful, responsible nurse do? NCLEX rewards the nurse who pauses, thinks, and checks, not the one who acts fast without thinking. If one answer involves notifying the physician and the other involves acting independently, ask yourself if you have enough information to act yet. If you're unsure, the safer answer is usually to assess more or notify the physician first. So safety, safety, safety. Here's one of the biggest traps on the NCLEX, and it gets students every single time. Do not pick an answer just because it involves the most action. Doing something feels proactive. It feels like good nursing. But the NCLEX does not always reward doing. It rewards thinking first. The rule is assess before you act. Unless it is a true emergency, like a patient who is not breathing, your first step is almost always assessment, not calling the doctor, not giving a medication, and not repositioning the patient. Assess first. Get the information you need, then act. The NCLEX loves assess first answers because a safe nurse gathers data before intervening. So if you see an answer that says observe and monitor or assess the patient further, don't dismiss it. That might be exactly right. The trap is picking the dramatic answer when the careful one is what the question is actually looking for. If you want to take everything we talked about today and actually build it into your study routine, I have something for you. My NCLEX study planner is available right now at katiecloset.etsy.com. It has a full NCLEX topic checklist, so you never wonder what to study next. And it includes a test-taking strategy section that covers priority framework, delegation, safety, and more things. Everything in one place so you can study with a plan, not just panic. So go check out the planner at katiecloset.etsy.com. I'll put the link in the description as well. So let's recap quickly. First thing, run your ABCs. Think about Maslow. Identify stable versus unstable. Ask what a safe nurse would do and assess before you act. If you found this video to be helpful, hit the like button and subscribe so that you do not miss the next one.